Thank you all so very much for this opportunity to be here with this really energetic group of people, and to Daniel and his colleagues for organizing this event. It's really my honor to be here and be part of this conversation about effective altruism. You know, when I was getting ready to talk with you and thinking about my long experience engaging with the folks at Well and 80,000 Hours and other places, and just sort of reflecting on, what does it feel like to be part of this effective altruism community? Effective altruism is sort of like saying hard head, soft heart. That's sort of what the mindset of all of you here in the room is, or you wouldn't be here. And I guess I think it's kind of it's a restless way of looking at the world. But we believe, we know, we feel that change is possible. But we're always conscious that, opportunities can be squandered if we don't also use our hard head and our rationality when making decisions about how to spend our scarce time or Bitcoin or bandwidth more generally. And, how do you feel, when confronted with the twin facts that in 1960, 1 in 5 children in the world didn't live to be 5 years old? Today, that number is more like 1 in 20. Over the past 50 years, we have made incredible advances in improving human well-being. People are healthier, wealthier, better educated than they have ever been. On the other hand, we're not there yet. 1 in 20. That's unconscionable at some level, right? But recent decades have shown us that enormous problems like polio, things that used to devastate communities, can, through our collective efforts, really genuinely be consigned to the history books. When I start thinking about this stuff, I feel a kind of like an agony. Examples like this mean that we can move roadblocks aside. Change really is possible for us. But why not more? Why not faster? How can each of us, in our own way, contribute? For me, personally, this agony, this restlessness, first led me to a small country in Africa called Swaziland when I was 19. And it's had me coming back there many times ever since, with lots of different hats on, but always working to make sure, to the best of my ability, that I contribute to seeing that philanthropy and government resources are spent as usefully as they can, and we achieve as much social impact as possible. And everybody here can have a meaningful impact when it comes to improving the lives of people in the developing world, the lives of people in your community. This doesn't need to be your full-time job or even your only area of philanthropy or volunteerism. But intentions in themselves will not yield results. So today I want to talk about what I think are 2 fundamental principles that maybe should guide your generosity, focus your attention, raise your spirits. And the first is fighting today's solvable problems, using evidence to guide where you can achieve the most benefit for a given level of investment. Again, whether that's your time or your money, doesn't really matter. And then there's this idea, and now maybe I'm pushing the limits here a little bit of card-carrying effective altruism, I'm not sure. But I want to talk also about helping to find the solutions for tomorrow. And the idea of not just scaling up proven things, but taking smart bets to find new solutions, generate new evidence about what works in ending poverty and social injustice. And that's really important because as energizing as it is to reflect on the fact that the world really is getting better, that 1 in 5 is now 1 in 20, we still have real problems to tackle that are going to need new ways of taking them on. I think that's pretty tantalizing. That's what we do at the Global Innovation Fund, and it makes me feel more restless than ever. So, okay, first on this question of fighting and tackling today's solvable problems. We really do have a powerful set of tools for taking on poverty and disease. We've made a ton of progress here in Europe, in the United States, but also in developing countries. We went from 1 in 5 to 1 in 20. And how did we do that? Part of the answer to that lies in a very, very simple combination of sugar and salt. In the 1960s, one of the big causes of child death, a big contributor to that 1 in 5, was diarrhea. Untreated diarrhea can very quickly lead to dehydration. In very young children, that can very quickly lead to death. And in the 60s, the standard of care for acute diarrhea like that was intravenous fluids. That's pretty impractical in developing countries with limited health infrastructure. So kids were dying of things that in Washington or in London or Prague, they would not have died of. And then in the 1970s, 2 researchers in Dhaka, that's the capital of Bangladesh, decided to try out a different approach to this problem. And they started with this idea that sugar helps the stomach absorb water. Part of how diarrhea leads to dehydration, leads to death, is imbalance of electrolytes, which you can correct with salt. So they created a combination of sugar and salt to help restore lost electrolytes and improve absorption of liquids. And they called this thing oral rehydration solution. When these packets of sugar and salt were mixed together, you could just drink them, was the idea, and bring children back from the brink of dehydration and death. They started out by just trying this out on 29 kids at the cholera hospital in Dhaka in the midst of a cholera epidemic, and none of those kids died. Later on, in larger scale studies, they actually showed that, at least compared to the IV fluids that were given in the 60s, this ORS was actually more effective in preventing dehydration and death. And the beauty of ORS is not only was it so effective, it was incredibly cheap. This is a solution that costs something like 10 US cents a packet. And nowadays, still, you find ORS in the most far-flung stores in rural villages. And the medical journal, The Lancet, has called this potentially the most important medical advance of the 20th century. This seemingly simple solution, this combination of sugar and salt, transformed the way that the public health community took on one of the major killers of children over the past 50 years. And let me tell you that there are other opportunities like that available to us today, things that aren't available in rural shops in the farthest flung village of Bangladesh. But if we could figure out how to get to that last mile, we could save millions of lives and improve the quality of millions of lives as well. But we need more than good intentions. We need more than really being inspired by that idea. We need to use evidence to guide where we achieve the greatest good. Just like those scientists in Dhaka started with a small project, scaled it up, checked whether there was evidence for what they were doing. That's what we need to make sure that we support more of today as well. Now I'll tell you a little bit of a different story, maybe one that's a little bit less inspiring than the story of ORS. Have you heard of this thing called Millennium Villages Project? Well, this is a program in the maybe early 2000s. And the rock star economist Jeff Sachs, who was sort of the leading light behind the Millennium Development Goals at the UN, raised $120 million from a range of philanthropists around the idea that they were going to implement a massive, big push of economic development in a series of clusters of villages across Africa. And they were going to demonstrate that with a series of inputs of water, agriculture, health interventions, you could dramatically reform these places, and that this could then be replicated and scaled up, and we had this path to ending poverty in Africa in the very short run. This got the attention of real rock stars like Bono, who made two traipses around to all of these villages and got people increasingly, again, as I said, excited about this idea. So how did that work? How did that $120 million work out for them? Did it do good? Did it do as much good as you could do with $120 million for rural poverty in Africa? Well, look, as a general rule, the answer to that question depends on what do you think would have happened in those places in the absence of that $120 million worth of investment, in the absence of that big push. And to answer that question, you need what the data wonks among us, of whom I'm sure there are plenty in this room, would call a counterfactual. You need to have formed a view about how much progress would have occurred in those places in the absence of the investment, so that you know how much of observed progress you can attribute to the $120 million worth of investment. In this particular case, there was really no plan at all to collect data on the counterfactual outcome. When Sachs and his colleagues, maybe even Bono, faced some criticism for spending so much money without a plan to have credible measurement of impact, they quickly did some analysis and announced to great fanfare that, in fact, the Millennium Villages Project was already delivering reductions in child mortality. But guess what? In villages that had not received this big investment, you also saw structural cyclical declines in child mortality. The lack of a credible comparison about what would have happened in the absence of the program prevents us from really saying anything about whether those resources were well spent, about whether those governments of those countries should look at what happened in those communities and change how they're spending their money. It doesn't tell effective philanthropists, effective altruists, much of anything at all about how to spend their resources. And unfortunately, the Millennium Villages Project is not alone. It's a high-profile example of well-meaning investment not grounded in evidence. But large amounts of money from governments and very well-meaning philanthropists goes all the time to programs with little evidence of impact and no plan for generating that. And this is as true in developed countries like my own and here in Europe as it is in developing countries. So that is not the hard head meeting the soft heart for real change. And for me, it makes me crazy. It induces an agony of a totally different kind. We really can do better than this. And we owe it to ourselves and the people living in those villages that had to go through the Bono visit and to our neighbors. So let me tell you another story. In my introduction, we talked a little bit about deworming. As an intervention that I've spent a lot of times thinking about how you take to scale. Let me tell you a little bit the story of that program and contrast it somewhat to the hubris of the Millennium Villages Project. So it's been well known, it's no secret at all, that millions and millions of kids for many, many years have been infected with intestinal worms. Even in the United States, it was only in like the 1920s or 1930s that stopped being a fact of life in the American South. But most people who are infected with worms don't necessarily know it. And it was sort of an open question for a while of how much should we care about this? Is this sort of an unpleasant fact that we should at some point take care of as incomes rise? Or is this something that in the world of public health we should actually prioritize, given that kids have many, many problems and we have scarce resources, et cetera? So in the late 1990s, a group of researchers decided to do an experiment. And they decided to look at, let's see what does happen if you reduce the burden of intestinal worms on kids. Do we see anything that might rise to a meaningful public health impact of this intervention? And so working with a local nonprofit in Kenya, they rolled out a school-based deworming program, treating primary school-aged kids for worms. That's another very, very simple pill, pennies a dose for those pills. And then they wanted to look at, did we really reduce the prevalence of worms? And what, if anything else, happened in the health and well-being of these kids? And it turned out a lot. Because these kids had fewer worms in their system, they were getting sick less often. They had less fatigue. They were attending school then more often. And in fact, when they actually did the math, the school-based deworming program was so cheap that each additional year of schooling that it induced cost something like $4. So that's dramatically effective and cost-effective relative to other things that were on the agenda at the time in Kenya, things like free uniforms or free school lunches. And we know in this case that the effects are real because data was collected to allow them to understand that wonky counterfactual. What would have happened to those kids if they had not received that deworming medicine? And what did happen to kids who were otherwise identical to them but who were not in the program at the time? And so today, it's amazing. Something like 150 million kids received school-based deworming last year. Partly thanks to Evidence Action, partly thanks to the Indian government and the Kenyan government and many, many other people. But still, there are tens, if not hundreds of millions of children who still could benefit from that. Pennies a dose for years of schooling, and then long-run impacts potentially for those people, at least in that original Kenyan sample, long-run, lifelong impacts from that stuff that, again, can be rigorously and credibly identified. This is an example of hard head. We know the benefits and the affordable costs. And soft heart. This is a real and meaningful way to help kids have a better chance of living healthy and productive lives. So, good candidates for your restless passion, your advocacy, and yeah, sure, maybe your money, financial support are going to bring together rigorous evidence that this intervention is better than what would have happened without that intervention, and evidence that this impact achieves outcomes better than the status quo at a low, affordable, doable cost. And you don't have to be an expert yourselves in that. I mean, maybe that feels daunting. Are you going to comb through the literature about this stuff? I mean, no. That's what's great about being part of the effective altruism community, is that you are as much a community of practice and a community of knowledge sharing as a community of doers together to help find yourselves, work your way towards the right answers to these kinds of questions, which may differ in the Czech Republic from what's the right answer to that question in the effective altruism community elsewhere. So now I said I would talk a little bit, I'd stray from the canon and effective altruism. I'm going to talk a little bit about what's next, about finding solutions for tomorrow. And school-based deworming is great, and I could have talked, and ORS is great, and I only scratched the surface of some genuinely cost-effective interventions that need more time, attention, and money. But I also think it's true that even the things we know about today that we should fully fund are insufficient to help us meet our goals over the next 50 years. The world is changing. More and more poor people are going to live in countries where they're actually in very close proximity to people who are very well off. Everybody's going to have a cell phone, everybody's going to have a smartphone, but a bunch of those phone users are still going to be people who are illiterate. Climate change requires very complicated cross-national cooperation and interesting strategies that take on inequality and long-run benefits for future generations at the same time in ways that are really complicated for us to all get our minds around. So it's not enough to just scale up what we know works. We need to take some smart bets on innovative approaches to try new things, to take on those new problems. That's what the Global Innovation Fund does. We operate beyond traditional grant making. We do not just help to scale up things that we know that work. And we're actually more like a venture capital firm trying to invest in innovation that has the potential in the future to affect the lives of millions of poor people. Why do we act like venture capitalists? Meaning follow the entrepreneur, go where their ideas lead us, rather than saying, we know what works, bring us your ideas about how to scale up these 7 proven things. Well, it's because precisely of that simple but kind of profound fact that if you had sat there ex ante in 1993 or whatever and said, how should we improve education policy in Kenya? I seriously doubt anybody would have said, a deworming campaign. We have to let experimentation and entrepreneurship and ideas take us towards new solutions. So 2 short, more little stories. I'm going to be right on time. What do you think are the leading causes of death in Africa? Probably when you think about that, you think about HIV, malaria, TB, right? Well, higher cause of death than any of those things is traffic accidents. Road-related deaths are a major cause of the burden of disease, mostly because of really poor road safety practices. And one of the companies that the Global Innovation Fund has invested in is a company that's called Safe Boda. So motorcycle taxis, called Boda Boda taxis, are ubiquitous and absolutely required to make transport work in most cities in Africa, especially in East Africa. And while they're ubiquitous and utterly important, they're also extremely dangerous. 60% of the surgical budget at the main hospital in Kampala, that's the capital of Uganda, is spent on head wound injuries from motorcycle accidents. So, a group of entrepreneurs has come up with the idea of Uber for Uganda, if you will, but Uber on motorcycles, where drivers wear helmets, drivers are trained in road safety, and drivers offer their passengers helmets when they get on for a ride too. So that means you can put your daughter on a safe Boda when you send her off to school, and you have to worry less. So if you had been sitting there ex ante and said, what would be a good public health strategy for me to contribute to in Uganda? I doubt any of us would have said, I think I should find a firm to invest in that's making Uber for motorcycle taxis. Like, we just don't know until we see it and we try it and we see how it works. One more example, and then I'm done with you. Seasonal hunger, big problem in South Asia. People go hungry between the time when you've planted rice and the time when you harvest rice. Especially kids, pregnant women, that's pretty costly for you. How might you tackle that? We usually would think of emergency food aid, maybe agricultural extension. How about bus tickets? Some economists from Yale and Bangladesh did experiments in which they gave people who were living on the margins of subsistence bus tickets so that you could send an adult male from your family to work in the city during the hungry season and send remittances back to the family. This resulted in an average increase in consumption for those women and children left behind of 600 calories per person per day, back to 3 meals a day instead of 2 during that hungry season. I wouldn't have thought of bus tickets when you talked to me about seasonal famine, but some entrepreneurs did. Now, look, we got to figure out how to scale those things up. Will Safe Boda work as they try and grow that firm bigger? Will their revenue model hold as their economies of scale change? Would the government countenance a program in Bangladesh where we send poor people from rural villages to the cities, even if it's only for a short period of time, if you really tried to scale this up? There's a ton of questions. I'm not endorsing any of those things the way I've, waved the flag for school-based deworming. But we've got to take some bets. We've got to try some things that might fail, in addition to scaling up things that work, if we're really going to fundamentally change how the current system's set up. So let me end with a little call to action for you. Peter Singer, probably his name has come up this morning, one of the founders of the Effective Altruism movement, tells the story of, imagine you are walking along and you come across a small pond and you see a child in that pond. You know how to swim, you could jump in and you could save that child, but you're wearing a nice new $100 pair of shoes. Do you jump in? I think most of you here in this room know the answer to that question for yourselves. And there are millions of children today struggling in that metaphorical pond. So my message to you is, jump in. hard head and soft heart. Thank you.